And good evening to everybody, and welcome to, and I can't believe I'm saying this, is the 9th episode of the second series of Maternity and Midwifery Hour. Welcome again. My name's Sue Macdonald, and I am the proud curator of these Maternity and Midwifery Hours, as well as the festivals. And those of you who are in the know will know there's a festival next week, so I hope I'm going to see you there as well. Now, these sessions, these weekly sessions, were designed to provide some interesting continuing profession development for midwives, for student midwives, for people who want to become student midwives, and for anyone who's interested in maternity services. And they're accessible live now, and over the next few weeks you'll be able to get this as you want from Matflix. Matflix, we want to say a big thank you to for the video streaming. There are midwifery experts, and it's a really good resource, I have to say. If for any of you who are due your revalidation or just want to learn more about any topics, this is the place to go. And I'm thrilled tonight to be joined by Sarah Esegbona-Adeigbe and Alicia Burnett, who are our speakers. So welcome to both of you this evening. We're going to be talking tonight very, very topically on dismantling racism and inequalities in midwifery education in particular. But of course, these hours, anyone who watches these hours will know I'm going to put both of our speakers on the spot and ask them for a little moment of the week. So can I ask Sarah, a little moment of the week from you?
Well, I'm still very happy about the US elections and waiting for Trump to say he had conceded. And there was some information that he had kind of admitted that actually he did not win. So that was a nice moment for him to say that.
I think there'll be some more moments coming from that, Sarah, don't you? Thank you for that. Now, how about Alicia? A nice moment from you.
Good evening, Sue and Sarah. For me this week, my moment of the week has been being a speaker at Cardiff University's Midwifery Society's Beyond the Bump conference. It was a fantastic event, loads of fantastic speakers, and we were discussing how maternity services could be improved to improve the outcomes of Black and brown women in the UK. And it was my absolute honour to be invited to speak.
Yeah, I followed the session. I couldn't get booked in, but I followed the session on Twitter, and it looked absolutely fantastic. So well done to everybody. It's fantastic. I hope people will be able to see. Were the sessions recorded?
Yes, there were some technical difficulties at first, but it's all been recorded, and let everyone know how to
access. Fabulous. So there'll be a little treat for any audience who want to access these. Thank you so much. That's fantastic. I'm going to just say and put us in context, because obviously these hours came from because of COVID, the COVID pandemic, and it is a difficult time. It's a strange time. I know people are talking about being freed up for Christmas, but we're still in a lockdown and we're still facing difficult times with COVID-19, with the death rate being very high, with infection rates being very high. The hospitals are busy. High dependency and intensive care units are getting busier. And we want to say a big thank you and send out love to our colleagues who are looking after people so well and the relatives so well, and also looking after themselves, I hope. And we want to also send a big hug and a thank you to our maternity colleagues, because we can't kind of cancel anything or focus just on COVID. We have to provide care to mothers and babies. You can't cancel pregnancy and childbirth. I always do say that, quite true. And we want to also send some sort of special healing thoughts to people who are suffering the after effects of COVID, or from this recently kind of being discussed long COVID, which is taking the energy away from a lot of people. It's not like an ordinary bug that you get and you get better. It seems to be taking a long time for a lot of people. So, and good wishes to all of those people who are in that situation. And also for those people who are self-isolating. I mean, there will be a lot of healthcare workers who are actually in this situation, a bit like Boris, having to isolate when they might not be feeling poorly, and they might feel very guilty because they can't be supporting their colleagues in the clinical area, but they have to do what they've been required to do. So good wishes and thank you to them as well. And a big thank you to all the key workers who are keeping everything going at this sort of time, just as they've kept things going since March. I'll move swiftly into the news, any news, and those of you who've been watching your news avidly will know that we've got 2 vaccines now, both of which are offering around about 95 protection. Well, when I say we've got the vaccines, they're on their way and they might be with us in the next few months. So look out for those coming near you. We're still on lockdown in England and in level 4 in parts of Scotland. Again, very difficult times. It's it's World I have to say this, watching very carefully, Antimicrobial Awareness Week this week. So it's very topical. And just to get a little Christmas flavour, this Sunday, for those of you bakers and cookers, and I know that the big baking craze that takes off, you may not know this, it's Stir Up Sunday this week. For those of you making Christmas puddings, this is traditionally the day you make your Christmas puddings and you stir them, and everyone stirs and makes a wish. Mustn't say what their wish is, but that's the tradition. I've done mine, and I didn't wait for this Sunday, sadly. It's also the RCM Maternity Care Support Workers Celebration Week. And also just to highlight the RCM survey that has been just published, saying that staffing shortages are impacting on safety and morale of maternity services. And this is very pertinent to the people we're talking about today. And this links also with a discussion on Twitter. I'm a bit of an avid tweeter, just in case you didn't figure that out, about overworking and glamorizing overworking. And if you're in that group of thinking, I've got to work really hard, I've got to be a bit of a heroine all the way through, go and look at a couple of weeks' time session on with Jenny the midwife and the lovely Maeve on looking after yourself, because that's really important. You mustn't be working just for the sake of it. You need to look after yourselves. And there was also, today was the UNICEF online breastfeeding conference, and some really interesting findings there. Again, highlighting the importance of breastfeeding and of support for women and families, and the importance of not separating mothers and babies at this time. Do check out the resources page, which will be available to you this evening, for updated RCM resources and references from tonight's sessions. It includes a link to the most recent report from the House of Lords into Black people, racism and human rights. It's actually published on the 10th of November, and it's actually really useful for you to read and have a look at. Okay, I'm moving now on to the main meat of the evening. And as I said earlier for the title, we have a discussion on dismantling racism and inequalities in midwifery education. And this has really come from the COVID pandemic, highlighting many issues, and including that of a higher mortality and morbidity for people of Black and minority ethnic groups. And I'm not sure now, and I'm sure I'm going to be learning this evening, that's a difficult phrase. So other terms are Black and brown people, people of colour, are being disproportionately affected by the pandemic. And also we had the death of George Floyd in the USA and the rise of the Black Lives Matter movement. And they really have highlighted that there's something wrong in our society. There's something wrong in our health services, in inequalities and bias. So it's not just society, it's also obviously within our health services. And in particular, the statistic in the maternity services are that Black women are 5 times more likely to die than white women. And there must be something wrong with that. And we need to start really trying to actively address this. And we need to look at racism, but we also need to look at our unconscious bias. And that means not just being anti-racist oneself, but you need to challenge racism and also look at the bias very critically and very carefully. And an example today, this very day, was there's been a big fuss, and I don't know if Sarah and Alicia have heard about this as well. Big fuss on a lovely advert from Sainsbury's, which features a black family and Christmas and gravy. And there's been a whole horrible response to it. There's been some good responses, but also some horrible responses, which indicate that it's very deep-rooted and difficult to deal with. So I'm going to start with Sarah, who's going to speak now. Enough from me. I've just set the context. She's a senior midwifery lecturer and course director for the short midwifery program at South Bank University and leads modules on complex needs in childbirth. She's currently undertaking a PhD at the University of Hertfordshire, exploring the perceptions of Nigerian women and midwives of cultural competency in antenatal care. Juggling. This woman is juggling, you can see. She's been a registered nurse and midwife for over 25 years. She's worked in the UK, in USA, and volunteered in Africa, supporting the fistula campaign and teaching midwifery skills and drills. She's had experience being an MMC fitness to practice panelist, caseload practice, and counselling those with haemoglobinopathies. She's also published widely on FGM and cultural issues in maternity. And she's going to talk to us about racism and inequalities within midwifery education. So welcome, Sarah. The screen is now yours.
So just start to share my screen. Hopefully you can all see that. And first of all, I want to say thank you for inviting me to speak on this platform. It is a privilege to be able to do so. And really, I thought I'd entitle this session as Midwifery Education During COVID, Dismantling Inequalities, Leaving No Student Behind. Before I start, I would like to thank my team at South Bank for the great teamwork and the great challenges we faced during this COVID-19 pandemic. You know, we are a supportive team, we are a small team, but I think we faced challenges very well, and also the student body and our practice partners. So moving on. First of all, I want to ask this question: are we all in the same race with COVID? The evidence shows that no one is immune from contracting the virus. That's quite obvious. However, the outcomes and the survival rates are really dependent on not just things that are in medical form, but also social, economic, political, and racial factors. These impact on a person's ability to overcome this virus and also to survive this pandemic. And so I'll call it a race in getting through this COVID-19 pandemic, which has obstacles, turns, and bends, which makes it difficult to compete equally. So first of all, I thought I'd get some background. Let's look at the international race. So what's happening in midwifery education in the greater environment worldwide? As we all know, equally with other healthcare, education and university courses, lockdown measures has imposed great disadvantages to education, particularly midwifery education. And I know in some parts of the world, when the lockdown first started in March, and in some countries even earlier, some midwifery programs are actually closed, placements were lost for students. And unfortunately, midwifery students have to undertake placement in order to complete the course, otherwise they don't qualify. And then what was decided by some institutions, what they would do is that they would offer the theory component of the course on online platforms. However, one of the biggest issues or challenges with conducting midwifery programs in the COVID-19 pandemic is the placement element. It's unavoidable. students have to undertake it, otherwise they will not qualify. If we look at what happened with the NMC in the UK, during the first lockdown, emergency standards were put into place. And this in particular enabled students in the final 6 months of their training to complete their training in practice. With the second year students, they were allowed to continue in practice with an 80-20% practice theory component. So that removed the 50-50 theory practice component required by the NMC. For the first year midwifery students, unfortunately, these students had only been in placement or on the course for about 6 months. And so they were removed completely from the practice area, and the rest of the year was completed in theory block. And for the whole of the midwifery program, it was decided that we would deliver, and also because of social distancing, the theoretical instruction would be replaced with distant learning. Now, since the end of September, the recovery standards produced by the NMC has allowed us to more or less revert back to conditions prior to the lockdown. However, as I think in most universities, the theoretical instruction has continued to be replaced with distant learning, blended learning, remote learning, because of course there's no face-to-face learning recommended because of the pandemic. Now, if we look at Health Education England, they tried to even out the race further. And this was allowing students during the first lockdown to have a paid placement role, and therefore second-year students, third-year students in the first 6 months of their training, and students on the shortened programme, they were allowed to have paid placement role, and this would include working as a HCA. But losing the supernumerary status, but obviously having the supervision and support that they required. And students were allowed to opt in or opt out of this. And of course, we're going to go through the many reasons why students did decide to opt out. So before I go any further, let's look at inequalities before the race even started. We know that in higher education institutes, there was already, I like to call it an ethnicity, not a BAME attainment gap, because obviously there's a lot of issues with the word or the term BAME, resulting in people feeling there's a loss of identity, and that using that kind of term loses people's identity. So there was an attainment gap of 13% between people from particular ethnic groups and white British groups, of about 13% for first class or upper second class degrees. There was already a high dropout rate for students from particular backgrounds. There was complaints about Eurocentric curriculums and lack of awareness of issues affecting students from different ethnic backgrounds in undertaking higher education. And when we look at academic staff, there was inequalities in pay and promotion for academic staff relating to their demographic, lack of diversity in academic staff, and unconscious bias was also an issue. And the term unconscious bias, it means different things to different people, but basically it's about stereotyping unconsciously. So if you meet someone who you've met before from a particular culture, country, with a particular accent, the attributes that you put to that person, you would apply it to the same person with the similar characteristics. So that's the simplest way of saying unconscious bias. And then within higher education institutes, there was lack of senior leadership from ethnic minority groups. And this was an important fact to consider, because if you have a diverse student body, but when you look at their academic staff and they are not diverse, then what does that reflect to students who are studying on the course? How do you think they feel when they see, right, there's no one that looks like me teaching me this course? Do they really understand what I'm going through? And am I able to be transparent with those people about how I'm feeling? If you go to the NHS, similar issues, but in this case, likelihood of midwives from particular demographics to undergo disciplinary proceedings locally, likelihood for these people to be referred to the NMC, cultures of bullying and harassment, organisational culture of discrimination and racism, again, unconscious bias, stereotyping unconsciously, lack of senior leadership from ethnic groups. Now, there's been lots and lots of issues around, we need to tackle this. Lots of organisations developed to tackle this. But we know that at the start of the COVID-19 pandemic, these were issues that we were dealing with already. So let's look at the impact of COVID on training for student midwives. First of all, and this affected me personally, the lockdown resulted in formal and informal networks of childcare disappearing almost overnight. Households were left to absorb care needs. And this particularly affected low-income houses, women, single parents, students maybe with underlying disabilities, and essential workers. Now we know that the schools were kept open for essential workers, but people didn't want to send their children to school regardless, because the fear of contracting this virus was out there. And also, if they had someone in the house that was vulnerable or needed children, you weren't going to send your children out. So this is what students were dealing with. And we know that the majority of the midwifery student population are women, and women are inherently normally the carers. So it's not just young children, elderly relatives as well. Now we know that students tend to take on jobs to supplement their loans. And during the lockdown, 34% of students lost a job, or basically we know that they tend to get jobs in retail and hospitality sectors. That more or less went overnight as well. And then if students were relying on families to support them, if those families were also employed in those similar sectors, that would be an issue as well in getting financial support from those areas. Now, there has been a prospective cohort study done by UK University around mental well-being of students during COVID-19. And it's demonstrated that there have been impaired and perceived stress increased during the pandemic. And this is around loss of support bubbles, students being isolated, not having peer support, not seeing their family members. And we know that before even the COVID-19 pandemic, there was a 5-fold increase on students, first-year students reporting mental health stress. And 94% of higher education institutes had already seen a rise in demand for counselling services. So that was the impact of COVID. Now, ethnicity, training amongst risk. Public Health England, and I'm sure we've all seen this report before, found quite early on that COVID-19 was diagnosed higher in Black ethnic groups. People from Bangladeshi groups, despite their sex, age, area, region, had a 50% risk of dying, or tries the risk of dying, compared to people of white British ethnic groups. And we know that people from other ethnicities had between a 10 to 50% risk of death when compared to white British groups. And one of the things that came out from the Public Health England review, which I was pleased to see, was they believed that historic racism and poor experiences of healthcare services impacted on people engaging with services. And people who worked in healthcare services, so that's our NHS staff mainly, were fearful of speaking up when they had concerns about PPE or any risks which would increase the risk of contracting COVID-19. So what does it mean to our student midwifery body? Placements, racing to the unknown. It's unavoidable to have to do the placement. Whether they did it, continue to stay in placement at the start of the first lockdown, and that meant that students would be disadvantaged if they couldn't opt in because of other personal reasons. And those students who were delayed going into practice because of trying to organise how they would go into placement, it was an issue. It's unavoidable placement. It's an NMC and EU requirement. So students have to face the risk of, having ill health, contracting the virus. The stats are out there. We need to think about the impact of COVID on the NHS midwifery and nursing workforce. If midwives are stressed to supervise this, then that would impact on the student body as well. It's unavoidable. It's, if midwives are stressed and they're having to, look after women and maybe deal with COVID patients, it's going to impact on the students that they are supervising. And then we have to think about the institutional racism and unconscious bias and an impact on the health of midwives. We do know that racism increases stress levels. And that's a fact. And we know that pregnant women, as Sue had already said, the risks of you dying in pregnancy is 5 times in Black women. It's 3 times in mixed race women and 2 times in Asian women compared to white British women. So it is an issue. So how do you overcome the hurdles in midwifery training? Well, first of all, we need to acknowledge this lack of strong leadership with a commitment to removing inequalities. And there needs to be open discussions about discrimination and race. That is not really present within midwifery training. It should be part of the curriculum. And if your curriculum is also not racially diverse or inclusive, that can be a problem as well. And then on the last point, we're not getting the evidence that we need in order to address the needs that students come into midwifery training with and the ongoing needs they have during the training program. During COVID-19, as I said, we more or less went to online teaching overnight. Now, I did read somewhere, and this is from an Open University lecturer, the skill of teaching online is a skill that can't be learned overnight. It's something that takes years to perfect, but we were having to do that almost immediately. So adapting the curriculum into an online format was really, really difficult. So online teaching, pre-recorded sessions, and I tell you, to pre-record a presentation takes ages, particularly if you're like me and I keep fumbling at every third or fourth slide and have to go back. It's almost a nightmare. And then also, devising teaching that is student-led and motivating enough to allow students to want to engage with the student-led learning. And then obviously teaching with methods that recognize diversity and encourage inclusivity. And it's about, looking at the student you are teaching to and recognizing that they may come from a different background and trying to embrace that, because that was what piques students' interest. We also have to acknowledge students' learning styles. We know that students, some are visual learners, some are auditory learners, and some are kinesthetic learners. And so making sure that there's a variety of learning delivery methods so that we do address students' learning styles. And then, of course, making unbiased and fair assessments. And of course, all our assessments now are online. So our OSCEs, our face-to-face OSCEs, which were normally demonstrating a skill, that's going to be done online. And, not everyone is really good at using the computer. It's a skill that they had to learn. We don't tend to be, I'm on the computer sometimes 6 to 8 hours in a day, and that's normally not what I would normally do, but it's unavoidable now. This is the world we're living in. But I do say to students, you are very lucky now, because when I was training, we didn't have the world at our fingertips. When you want to find a piece of research or paper, you can just click the keyboard and find it. I had to physically go down to the RCN library. It was a day job, a whole day shift. I'd take my packed lunch, take my water, my money for my photocopier, and be there for the whole day, going through all the journals and getting my material for my next assessment. So in that way, we are lucky that this COVID-19, if we're lucky at all to have it at all, has come in this day and age where there is the technology. So continuing to stay in the race, continuing to train. Technical preparation of students, very important. Making sure they are prepared, so making sure that there's learning for students and acknowledging that we have a diverse world and not everyone would learn and embrace technology in the same way. I mean, it's very different if you're very good on your phone, but when you have to look at programs and software and hardware, it can be a little bit overwhelming. And obviously when we're teaching, and the platform we use at LSBU is MS Teams, you know, the amount of things that can go wrong with that platform is unbelievable. And then technical preparation of lecturers. And I'll talk about myself. I mean, some of my colleagues have done much better, but it has been a steep learning curve to get used to the software and get used to all the things that my computer can do. And leading on from that, you have to have appropriate computer hardware, software, and a really good broadband connection. And I know that in our university, students were allowed to apply for hardship funds to apply computer equipment and any other equipment they thought that they would need, because obviously it is expensive to have to go out and buy a computer at the drop of a hat when you haven't, you know, expected to. And then motivation to learn online is very important. Acknowledging the demands on the students and the relevance of the contents, and just being aware that students have to have an appropriate learning environment. And if it's in their homes, being aware that there may be other things in the home that's impacting on the learning. There may be people in the house. There may be other pressures on the time, which is not related to the course, which they still have to, you know, pay attention to. And just be aware of unconscious bias, discrimination, and racism. So addressing inequalities, let's make it a fair race. Zero tolerance of discrimination and racism, making sure we have those open discussions is important within university settings. Exploring students' perceptions and experiences. Risk assessment, which should be culturally safe. And I know that Public Health England talked about culturally competent, but culturally safe, letting the student decide what is culturally appropriate, not you. Health education, which is culturally safe as well. Being aware of mental and well-being of students, acknowledging their socio-economic pressures, pastoral support, practice support, theoretical support, and digital support, all very important. So I'm going to end it there and look at training in the future. Now, the Commission on Race and Ethnic Disparities has asked the government to look at ethnic disparities, and one of the focuses is on education. And there's a survey going on which ends at the end of November. And also, NET's National Education and Training Survey is particularly looking at health education students. I'll ask them to, you know, go into this survey and answer questions about their experiences of learning. So thank you, I end it there.
Okay, that's great, Sarah. Thank you so much. Of course, we've given you, and I have to say, we always give our speakers, and they've only got time to do a snapshot really. And I think Sarah's done brilliantly with that, because it's shown us, well, it's a mountain that has to be climbed, and that mountain's been there for a while, and we've only just kind of noticed it. I say we as a royal we, really, and it has to be addressed now. And thank you for giving us some homework. So there are 2 surveys to be completed, and for those of you who are watching, don't be shy. These surveys are for everybody to put, you know, you put feedback in there. This is your time to be a little bit politically astute and put your view in, because your view is just as good as anybody else's. And they're always very welcome to get feedback on any of these things. So thank you very much, Sarah, for giving us that. Now, if you have any questions, and I can see, and I look at my other screen to see there's questions already coming through. If you have questions for Sarah and for Alicia also, just write them down and send them in now. So without further ado, I'm going to introduce Alicia Shirley Burnett. And I always say Burnett, but it's probably Burnett, is it?
Burnett, yes.
Burnett, who is a 3rd-year student midwife. She's works in London. She's editor-in-chief of the Student Midwife Journal and curator of the COVID-19 cohorts blog, which I think is coming to an end, but has been a huge part of what she's been doing for the last few months. She's also a very prolific tweeter and blogger, and very much a modern influencer. So welcome, Alicia, and thank you very much for coming. The screen is yours.
Thank you very much for having me. Please forgive me if there are some technical difficulties. I've been having a complete nightmare with my laptop lately. I'm going to try to share my screen. Fabulous. Okay, I'm going to start. Thank you so much, Sarah. You really beautifully framed how structural racism affects midwifery education. I had a hard think about what I wanted to put into this presentation. I very much am aware that discussions about racism in maternity services and midwifery education is a very emotive, very explosive topic. And I very much wanted my presentation, to be somewhat solution focused. So let us move on. So I want to present things, solutions, activities, actions that you can take as an individual, as a lecturer, as a group, things that you can do to address the structural racism within maternity services and its impact upon the women that we care for. So I'm going to discuss what you can do as a student using social media, through writing articles, holding conferences, doing online training. And I'm also going to suggest and recommend some social media accounts for you to follow. So this is me. I am a student midwife. I'm a third-year student midwife based in London. That's who I am. I'm very, very proud to be a student midwife. I wear that badge with honor. I'm also the editor-in-chief of the Student Midwife Journal. So me, as a single student, I use my position as the editor-in-chief to affect change. So as you can see here, we have the October issue of the Student Midwife. It's entitled We Rise. It's open access, so you can access this issue anywhere in the world without subscribing. And it was very important that we did this because this issue is completely authored by Black and Brown authors. And in this issue, we cover topics such as female genital cutting or female genital mutilation. I make the argument in this article that midwives and student midwives need to receive culturally sensitive education about female genital cutting in order to improve the health outcomes and pregnancy outcomes of female genital cutting survivors. There's also an article written by a white presenting student. She's actually British and Arab. She writes about her experiences of white privilege and how they affect interactions within the maternity setting. We have a fabulous article by a student named Natalie Goodyear from King's. She has come up with an anti-racism pledge for midwives and student midwives. There's an article about that in there. This issue is open access. You can access it wherever you want to in the world. As a student midwife, as a midwife, as anyone interested in maternity services, I implore you to please take a look. It's not easy, it's not comfortable to examine racism as it applies to education and maternity services, but it's time. So that's just one example of what you can do as a student. Literally read this issue. If you ever want to submit anything to the Student Midwife, that's my email. I get back to you as soon as I can, I promise. I'm very busy at the moment, but I make a valid and valiant attempt. Okay, what else can you do? So during lockdown, I was opted out of clinical practice. This was around the time that George Floyd was murdered. And I'm Black. I'm quite visibly, unambiguously Black. I'm aware of racism. I know it exists. I know it exists in every single country in all different guises. But the murder of George Floyd, I couldn't watch the video. I couldn't watch him die. I couldn't watch him be murdered. It was awful. It was extremely harrowing. And I was numb for a good few days. But actually, it also acted as a catalyst for me to use my social media platform to advocate for cultural sensitivity in midwifery practice and midwifery education. So I have a background in pediatric nursing, and I'm familiar with the term Mongolian blue spot. But following Mr. Floyd's murder, I began to examine the language that we use in practice, the language that we are taught at university. I began to examine society as a whole, and starting with what I'm familiar with, which is looking after sick children and babies, and now looking after healthy and unwell women in pregnancy and following childbirth. So I began to look at the language that I've been taught. And I started with Mongolian blue spot, and I really started to ponder, where did this terminology come from? Because I know that this birthmark can present in children that are not of Asian heritage. So I looked into the origins of who coined the term. I very much suggest that you do the same. And I also began to wonder why, if anything, the term Mongolian blue spot is inaccurate because it presents in children of all types of ethnicities. It's not just exclusive to children of Mongolian heritage. So firstly, it's inaccurate. Secondly, it's racially insensitive. Please do look that up. And there are multiple alternatives. You can call it a blue-grey nevus, a slate-grey nevus, or congenital dermal melanocytosis. There are so many terms, alternatives to Mongolian blue spot, that we really don't have an excuse to keep using this racialized and outdated and inaccurate terminology. And after this social media post that I made on Instagram, I received quite a few DMs, so direct messages from not just student midwives or midwives, osteopaths, podiatrists, pediatric nurses, and a number of them wrote to the NHS website, which is where I found this image. It says blue-grey spots. This is what they have changed it to, but originally this was termed Mongolian blue spot. And I believe that if you look at the NHS website, I think for Wales, it still says Mongolian blue spot. Don't quote me on that, but please do have a look. You have power. As an individual, you have power. If you use social media in the right way and to be a positive influence, you can affect change. I made this post. A lot of people swarmed together to contact the NHS, the curators and the organisers of the NHS website, and it was changed. What else can we do? Just think about that. So I made this post in June. By July, it was changed. Okay, so just moving on. What else can you do to affect change? So following that Instagram post that went viral, I was invited by a very esteemed nursing professor to write an article, to co-author an article about systemic racism in nursing and midwifery. So this team is made up of students and academics from the UK, the US, and Australia. I was very, very intimidated. I ummed and ahed for a very long time because, yes, I've been published before, but not about this topic and not in the company of such esteemed colleagues. I was frightened and I buried my head in the sand for a few good weeks. But that's not me. I don't run away. I might hide for a little bit, but then I face whatever it is that is frightening me. So we came together and collaborated to create this piece about dismantling structural racism in midwifery and nursing education, because in light of COVID, as Sarah has beautifully explained, that COVID-19 affected people from marginalized ethnic backgrounds the worst. In light of George Floyd's murder and the uprising of the Black Lives Matter movement, in light of it being the 2020, the year of the nurse and the midwife, it was past time for a piece like this to be written. This piece is also open access. We couldn't write something like this and then just lock it away. It has to be open access, so you can access it. You can access it freely. I'm going to attempt to read this quote. There are many, many quotable sections of this article, but I just picked just this one. Nurses, midwives, and the academy can no longer be complicit in the silences around structural, individual, and ideological racism. Silence is not neutral. Karen and Katz's uncompromising challenge to doctors applies equally to nurses and midwives when they write that our silence speaks volumes. It is saying that the death of an innocent Black man at the hands of a brutal white police officer is still not enough for you to put your own skin in the game. Now, if we substitute the murder of George Floyd for the Embrace report, which quite clearly states that Black mixed ethnicity and Asian women have poorer pregnancy outcomes than their white counterparts, what does that mean for nursing and midwifery? It means that it's time to act. It means that staying silent, letting things happen, letting comments, racially insensitive, racially aggressive, microaggressions, letting that slide, pretending we don't hear it for an easier life, it's not enough. Last night, I listened to an Instagram live between Mars Lord and Ilian Morrison. So Mars Lord is a doula, an award-winning doula, and Ilian is a registered midwife. So they were discussing the topic of racism within maternity services, and Ilian made the point that, so it's a common question. Okay, I hear racism, I hear racial language, I see inappropriate conduct, misconduct that has racist undertones or overtones. What do I do? And her response is quite simple. Say something. Say something. If you see something, say something. It doesn't just apply. Now this, I'm just going to be honest with you. If you're a white student and you overhear or witness a Black student being racially abused, say something. If you're a Black student or a brown student and you witness a Black or brown student being racially abused, say something. It's not easy, but it's the right thing to do. I've been guilty myself of overhearing a lecturer saying to a student, I can't understand your accent, or someone has told me that they've received feedback on an essay that I can tell English isn't your first language. And I've consoled the person, but I didn't say anything to anybody that could affect any change. So I've been guilty of that myself. But I'm here in front of you today to say that it's not enough. It wasn't enough then, it's not enough now. Going forward, it's not going to be enough. If you see it, say something. So basically, back to this article, the crux of this article is basically stating that nursing and midwifery, we aren't doing enough to tackle the maternal inequalities that have been going on for years. They predate the 2018 and 2019 Embrace reports. In the conference on Monday, the Beyond the Bump conference held by Cardiff Midwifery Society, Elsie Gale made the point that reports and statistics relating to poor maternal outcomes for Black women have dated as far back as 2001. It's time to do something. So what you can do as an individual, as a writing group, you can write about what is happening and you can propose changes. So what this article did is we stated that what's happening isn't good enough, and we are now writing a follow-up piece to examine what has been done since we published this article. So please do look out for that. And as you can see at the bottom here, I have included all of my wonderful co-authors. These people are all on Twitter, I think apart from Linda, but the rest of them are all on Twitter. Please do follow them. Fantastic content creators. Okay, thank you. I have 2 minutes left, so I'm just going to whiz through the rest. What else can you do? As a university, as a midwifery society, you can host a conference such as the Beyond the Bump conference held by Cardiff University Midwifery Society just on Monday. It was fabulous, and it was sponsored by RCM Wales. You can do this. This was a group of, I think, 6 student midwives. They put this together. They invited the speakers. They ensured the speakers were paid. They paid the Black and brown people that were speakers at that conference. They paid them for their emotional labor. I was an emotional wreck after that conference, listening all day to all the terrible things that happen to people that look like me because of the way that they look. It's emotionally draining. It's emotionally draining. So the very least that you could do when you do ask these speakers to attend your conferences is pay them. It's the very, very least you could do. Beanish was fantastic. So was Mars, and so were 5 times more. So again, something you could do is host a conference. Okay, I am editor-in-chief of the Student Midwife. The Student Midwife and the Practicing Midwife are owned by All for Maternity, which is owned by Sheena Byram and Anna Byram. So All for Maternity, we're in the process of curating and producing some anti-racism e-learning, which will be finished and ready for you to access in spring 2020. So we're right in the middle of creating this right now. So that's another thing you can do. You can seek out online, because of COVID, online virtual education such as e-learning courses, workshops, masterclasses. I have provided some such resources in the resources that Sue will provide afterwards. Please do take a screenshot of all of these wonderful people's social media accounts. I made the point on Monday that if your social media they're just carbon copies of who you are as a person, what are you going to learn? So follow these people and learn about the work that they're doing in maternity services and beyond to combat structural racism. And that is me. Thank you very, very much.
That's great, Alicia. One of the things I always find about these hours is they go so quickly. And it was really fantastic. Thank you so much. You've also given everyone homework to do, which is great, and a bit of reading. See the article, and it's a very nice article to read because it's not too huge, but it's really important that we read about this and also write. I think that was a really good thing to highlight, Alicia. Now, we have a couple of questions. I'm also very aware of the time. I'm looking this way, audience, so that am I over screen? I have a question from Elsie Gale, who says, and this is a question for Sarah, I host an accredited aspiring midwife course and have found that a disparate number of non-white students fail to get into midwifery. Many are signposted towards nursing instead. Okay. Is there any collection of this ethnicity of applicants so we can understand the numbers? And how can we address this disparity in data versus anecdotes? That's interesting. Thank you, Elsie. Good question.
Well, first of all, the entry requirements are set by each university. And I think you have to acknowledge the attainment gap is not just at higher education, it's also within secondary education as well. And so that is something that needs to be sorted out. Why are students not achieving the grades to enter into the midwifery training course? Why they're directed to nursing, I can't really answer that. It may be that it's felt that midwifery being an autonomous practice or autonomous, ending up as an autonomous profession, maybe they feel that the more, would be more feasible to go into nursing, or it could be that the entry requirements are different for nursing. So that's something that really needs to be looked into.
That's great, thank you. I mean, it also may be in some universities, of course, that the nursing recruitment isn't as heavy as midwifery. I know that there are many applicants for midwifery student places, and I know that there might be some difference there. But thank you, Elsie, for that question. Thank you, Sarah. Then I have a question from Lola Ornato. Hi, Lola. She says I want to mention FGM in terms of some of the little things we can do to make a difference. I'm on a forum for Nigerian women and we have been discussing FGM. There are lots of women, my friends included, that do not even know whether they've been cut. I've been using social media to do some teaching on anatomy and encouraging women to ask those important questions and be empowered. I think that's a kind of comment, and I don't know if Alicia or Sarah would want to make a comment on that. I know, Alicia, you were talking about, and you made a particular point about cutting rather than FGM.
So for the article that I wrote about female genital cutting, female genital mutilation, I interviewed Hiba Wadare with another student midwife, and Hiba made the point that, firstly, I want to say that women that are affected by female genital mutilation are not hard to reach. There are lots of barriers in the way to them being able to access maternity services. So one of those things is culturally insensitive language, or the feeling that you're going to be harassed, or the feeling that you're going to be racially profiled, or you're fearful that someone's going to call social services on you. And she made the point that some women may take offense to the term mutilation. So I made that point in the article that firstly, where possible, use the terminology that is appropriate to that woman's culture and have that discussion with that woman in regards to what language she is comfortable with you using. Don't impose any of your ideals or your preferences upon that person. It needs to be the care that you give needs to be responsive to that person's individual needs. So I use the term culture, female genital cutting for that purpose, for that reason. But I'm aware that it's not used in any of the national guidance or legislation.
Okay. So I suppose what I would kind of be thinking as you were talking, that it's using terms that are culturally sensitive is quite difficult if you don't know the people. And part of this for us as midwives and us as women is actually getting to know different cultures and actually actively asking people, which can be quite uncomfortable, I guess.
It can be uncomfortable for us, but it's not really about us. The care that we give needs to be informed by the communities that the care is designed for. So we need to engage with community leaders. We need to engage with the affected women and ask them, what is it that you need from us? What can we do to help you? Rather than imposing our ideals upon them, if that makes sense at all.
It makes beautiful sense. Thank you so much, Alicia. That's really good. Now I've got another question, and this again is something that it's kind of, there's not going to be an easy answer to this, I don't think. Joy Palmer, hi Joy, says, question, black, BME or BAME? Or none of those?
I'm black, and I'm of Jamaican heritage. My grandma has her accent, so does my granddad. I'm black. And if I meet somebody, sorry, Sarah, I just jumped right in there. Very sorry about that.
Sarah will jump in a minute.
I feel that it's respectful to ask each person that you meet, hi, my name is, what's your name and how do I pronounce it properly? And what do you identify as? Are you South Asian? Would you like to leave it there? Or would you like to tell me that you're from Pakistan? It's not for me to tell you who you are. It's for me to sit and listen to you and ask you, who are you? How can I help?
Okay, nice one. Thank you. How about Sarah? Did you want to comment on this one?
Yes, so I do know Joy Palmer very well. We've worked together for long periods of time. And so I understand we had the discussions about this term. And yes, BAME is a term that a lot of people struggle with, unfortunately. Or fortunately, it loses the identity of people. I've used it in publishing because that's what's accepted. I sent my paper in and I said, no, come back and use the recognised term. But to tell you the truth, I've yet to find out where this term came from. Now, when you use the term BAME, you lose the black and the Asian. And then who are the minority ethnic? Who are they? Do you know who they are? I have Spanish colleagues who say that they are minority ethnic because they're a minority in the UK. Then I have Polish colleagues who say they are minority ethnic. So I think we just need to now, dissect that term and just say, if we're talking about black women, let's talk about black women. If we're talking about Asian women, let's talk about Asian women. And I think I'll just end it there, otherwise I'll get too political.
No, but I think that's good because for me, the word that feels uncomfortable is the minority, because it feels as though it's not as important somehow. And I know that people are using the black and brown now and using, I tend to sometimes use people of colour or women of colour. But I mean, even that you can get it wrong. So, and I'm very conscious of not wanting to get it wrong. So thank you for Joy for that. And thank you to Alicia and Sarah. I think we've got time for one more. And this is from, well, I think this is a comment, Nafisa Anwar. Hi, Nafisa.
Hi, Nafisa.
And she is saying, this has been an amazing forum. Thank you, Sarah and Alicia. It brought a lot of emotions in me as I've seen and heard things during my career, both as a nurse and a midwife, and I'm guilty of not speaking out. I think we all are. And I think Alicia made a brilliant point there. However, as I have changed and do speak out now, and as you say, enough is enough. We need more doing. Having people like you both to inspire the rest of us is wonderful. Thank you for your passion and paving the way for us all. That's fantastic. I think we're going to finish that That's just a wonderful. Thank you, Nafisa, for putting it so beautifully. Now, I could listen to both of my colleagues forever, actually, because they both have the passion and the knowledge and the kind of the need to kind of share beautifully. Thank you so much, Alicia and Sarah, for coming this evening and sharing your expertise and your thoughts and ideas for the future. Because as you were both talking, I was thinking this feels like a huge mountain, and I started thinking it sounds like an elephant. And they say, well, you have an elephant, you eat little bits, you don't eat the whole elephant, you eat bits. But I don't like that analogy. But I think with the mountain, I'm thinking, well, it could be just a big mountain, but we could actually start digging away and taking that mountain away. And we do need to do it. And it's absolutely shameful that we haven't been able to do more, but it starts. And it has started, which is fantastic. Now, some of us will be on social media to answer some questions if anyone has any more questions. And resources are available, including all the references that Sarah and Alicia have alluded to, and a couple of good websites that you can access. I didn't get all the Twitter accounts or Instagram accounts, but I'm sure if you needed to, you could just follow Alicia on Twitter and you'd soon find out, and Sarah too. Now, just you need to look out for October's Student Midwife Journal. I jotted that down so I wouldn't forget. Next week, we have a Scottish festival, so we'll probably have a kind of edited highlights in the evening for that. If you haven't booked for the Scottish festival, do book now. Some really good speakers. The week after next, on the Wednesday hour, we're going to be looking at sustainability in maternity and midwifery. And we've also got the 13th of January. It's our London-based festival. It's online, but it's London kind of focus, I guess. In the meantime, thank you very much for attending. Thank you again to Alicia and Sarah for being such fantastic speakers. You'll have to come again. You must come again. And thank you to the audience. Just keep well. Give your loved ones an extra hug. And see you next week.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.